Come in.
Hi, Mr. Willie. My name is Lauren Stewart. I'm a nursing student at the University of South Alabama. I'm going to be doing your cardiac assessment today. Is that okay with you?
Yes, ma'am.
All right. I'm going to give you I'm going to give you some privacy. You're going to remove your shoes and your shirt. So I'm going to walk out the door and let you do that. All right. You're going to come back in, perform some hand hygiene, and come around to the right side. This is. So to start my assessment, I'm going to be looking for that apical impulse that's on the left side of your body. And let's see across the pericardium, just in case I can see it, the chest area. I think I can. Yes, there it is. So I'm also going to check for any kind of lesions, bumps, hives, anything on your chest. I'm not seeing any. Anything, so there's no cause for concern. And then I'm also going to state that the apical impulse is seen at the 4th to the 5th intercostal space, moving from the ventricular line to the left side of the sternum. So I'm going to look for any kind of bumps or anything that would make me any cause for concern or not be able to identify, and I'm not seeing anything. Your chest looks really nice. Now I'm going to state that the normal heart rate per minute is 600 to 100 beats per minute. And that's regular and not irregular. I'm also going to state that the base of the heart is found at the 2nd intercostal space, behind to the left of the sternum, and the apex of the heart is at the 5th intercostal space. It's mid-clavicular line of the left side of the sternum. Now I'm going to palpate with one finger at the apical impulse on the left side between the 4th and the 5th intercostal space. So I'm going to have you breathe in, and I'm going to have you hold your breath. Alright, and I can feel the apical impulse on the left side of your sternum, okay? So now I'm going to move on to oscillating the valve sounds. And my main locations are the aortic valve, which is located at the 2nd intercostal space to the right of the sternobordum. The pulmonic valve that's located at the 2nd intercostal space to the left side of the sternobordum. The tricuspid valve located at the 4th intercostal space to the left of the sternal border. And the 4th one, which is the mitral valve, which is located at the 4th intercostal space to the right of the sternal border. So now I'm going to palpate with my bell and listen to your heart rate and listen to the oscillating breath or the oscillating heart sounds, okay? Alright. Hold on your bell. Alright, so after I'm looking at your sounds, I heard no extra sounds, no kind of defects or anything, so that's really good to hear. So now what I'm going to start doing is checking your pulse your pulse deficit at your body. So I'm going to start with you turning your head to the left for me. And I'm going to go from your carotid. Okay. And I need you to take a deep breath and hold it. All right, you can breathe. Now turn your head to the right. So now I'm going to listen to it on the right, so you can take a deep breath and hold it. All right, so I heard no breweries, so now I'm just gonna check it regular, so you can breathe regular, okay? All right, turn your head. All right, very good. So I heard the breweries and your carotid seemed like it was working good. So now I'm going to palpate your pulses. So I'm going to start with the carotid on your neck. So turn your head. All right, turn your head. We'll go with your brachial now. There you go. All right, I'm gonna go with your radial. We would do, in a normal exam, I would do your femoral, but it's in the groin area, and I'm not gonna be doing that. And now I'm gonna check your dorsal thumbs that are in your feet. All right, and now I'm gonna lift your legs and check for any kind of edema. All right, see none. Good. So now I'm gonna check your perfusion in your hands and your feet. I'm gonna check your hands. Your nails are convex and pink. The papillary refill is normal, it's less than 3 seconds. And then I'm also going to have you take your hands and do a diamond like this for me. Just like that. Middle finger with that. You're okay. Just like that. Put them good. Alright, the diamond is visible, so that means that your nail bed angle is less than 160 degrees and there's no clubbing present. So, I seen also when I was palpating your pulses that they were 2+ and equal in blood flow bilateral throughout your body, so this is good. It seems like you're healthy and your circulatory system, cardiac assessment went great. So, thank you.